Well, welcome back, everyone. Today, I am joined by Dr. Jeremy J. Heffner. He's a general surgeon with Lima Memorial Health System surgical specialist, and to talk about an innovative procedure for patients suffering from GERD, or gastroesophageal reflux disease. Now, it's called the LINX Reflux Management System. So, firstly, doctor, can you tell us what GERD is and the symptoms it causes in patients?
Your body produces hydrochloric acid in the stomach. And for some people, the ability to prevent that acid from going backwards up in your esophagus, this doesn't exist. It's basically the anatomy changes with time, and so it allows that to happen. And people that have those symptoms, usually they're going to experience burning sensation in the chest, or they're going to notice in the morning they have a metallic taste in their mouth. Some people have a chronic cough that develops because at night they're actually refluxing into their lungs, and it causes irritation of the linings. And so it can also even get as bad as to get recurrent pneumonias. So there's a lot of different symptoms, some minor, all the way to extreme. And for some people, it's every day. It's all they deal with. It's just this burning and pain that they get from this reflux constantly.
All right. So now people that do suffer from GERD have this new option for treatment. What exactly is the LINX Reflux Management System?
Historically, we've been using medication. The LINX device, though, is a new surgical option. It's not really that new. It's been around for over 10 years. We waited till they had 10 years worth of data before we started to place them here. But what it is a series of titanium magnets that actually get placed around the esophagus, where the esophagus attaches to the stomach. And so when you eat, the food goes through it, it opens the magnets up and it closes them back down, creating basically a new type of sphincter to prevent any acid reflux, and allows us to get you off the medications long term.
Huh, very interesting. And what are the benefits of this procedure versus other surgical options, or maybe just taking medications?
Twofold. On the medication side, we're starting to discover the PPIs, the omeprazoles, pantoprazoles, the medications that are designed to shut down acid in the stomach. It's starting to look like long-term use of these can actually lead to increased risk of early dementia. That data is relatively new. I'd say in the last 9 months, there's been a big push to get people off of these for that reason. So it's something to look at, because we used to think that these medications were relatively benign, but it turns out there may be a long-term complication or side effect of that that's actually quite deleterious or bad. From a surgical standpoint, the other methods that we have, which we're using the stomach itself to wrap around the esophagus, they have a high rate of recurrence, meaning by 5 years, 40% of people are back on a medication. The anatomy just changes with time. It's a soft tissue. The body doesn't stay the same. After you fixed it, it starts to go back to its old way in some respects. And the LINX device is good because it's basically durable. It's going to stay as effective in 6 months as it does in 6 years, as it does in 60 years. And the other thing about it is, let's say you don't, like about 3% of the population today don't tolerate it well, which compared to the old wraps is a much lower number. Even in that scenario, undoing a wrap is quite difficult. Taking a LINX device out is not. I mean, in the last 100 I've done, I have had to remove 2, which is right in line with what we'd expect, and they've come out quite easily. So if you don't like it for some reason, it's much easier to reverse than if we did an old surgical option, which is much more complicated to reverse.
Huh. Wow. All right. Well, some people might be interested or hesitant to undergo surgery, especially if it requires a significant amount of time at the hospital. So what can a patient actually expect with this procedure?
We're very efficient in our system, and we've been doing robotics for years. We're one of the robotic training facilities across the country. And so this is all done robotically, little holes. I usually do it through 4 little holes. It takes me about 40 minutes to place it, about an hour to put you to sleep, wake you up, go through the process. Most of the time, we just keep you overnight to make sure you're able to tolerate food and everything properly and get you home the next day. It's a pretty straightforward procedure. As I said, as everything goes well, by 6 to 8 weeks, you're back to normal diet and back to your old self, except for now you don't have the symptoms and you're off the medications. The vast majority of people have been very happy with it. And it's been better than I expected over the last 100, 115 cases we've done.
Yeah. Now, I understand that you've surpassed completing 100 of these procedures, putting Lima Memorial in the top 5 facilities in the Midwest that have completed more than 100 LINX procedures in less than 3 years. That's awesome. Now, what does this achievement mean for our patients and the community?
I think that it's a reminder that here at Lima Memorial, we have a really good team of physicians, nurses, staff. We've really developed our robotics program over the last 10 years, and this was simple to implement and add to that. We really already had the processes in place to get these patients through the system. We had to make some additional changes just because it was a new device and a new procedure, but it has not been a huge lift for us to add this to the repertoire. Many things we're capable of doing here at Lima that we really advanced in the healthcare field, in the surgery field. We like to be on the cutting edge, and we have very good, not just surgeons, but like I said, staff, anesthesia, nursing that's able to work with us to get these things accomplished quickly and to become very proficient and good at them at a relatively good rate. And that's what we've done. Once again, we've just proven that we're capable of doing the most advanced medical techniques that are already out there.
Yeah. Now, I will say that, if somebody is interested in the LINX procedure, we did put a number on the screen for them to call. And I have to say, Dr. Heffner, keep up the good work. Congratulations.
Well, thank you. I appreciate that. You have a good day.
All right. Well, don't go away because we have more in return.